I don't feel mentally well enough to return to taking care of patients with a baby at home that still won't take a bottle. That is what she wrote to Dr. Tufts. I know this will trigger my anxiety.
I don't feel mentally well enough to return to taking care of patients with a baby at home that still won't take a bottle.
There's so many emotions. Lindsay Clancy killed her 3 children, but that's not what's up for debate here. She admitted it in a malpractice civil lawsuit. Her and her team filed 2 medical providers. They filed it against 2 medical providers and their employers. Her defense attorney, Kevin Reddington, said in his opening statements that Lindsay is aware that she killed her children, and she's not trying to deny that. So now the big question for the jury, was Lindsay Clancy at the time of her children?
That sentence appears in the medical record. It was written by Lindsay Clancy in September 2022, months before her 3 children were killed. The note is not dramatic. It is flat, clinical, exhausted. And now it sits inside a criminal trial as both a cry for help and a piece of evidence. Think of that note as a smoke detector going off in an empty room. The alarm is audible. The timestamp is exact. But the record shows no one opened the door until the smoke had already filled the house. Before we go deeper into what the documents actually show, make sure you're subscribed. The basic facts are not disputed. Lindsay Clancy killed her 3 children in January 2023. She then attempted to take her own life and survived with paralysis from the waist down.
Psychiatrist Dr. Jennifer Tufts. She started treating Lindsay in September of 2022, and that was just what they described as just months before the murders. In court, she talked about her appointments with Lindsay and said there were roughly a dozen sessions. At the first session, she told Dr. Tufts that she was not suicidal, but she talked about being overwhelmed and feeling anxious, leaving her baby. She said Lindsay asked her to help extend her maternity leave, citing postpartum anxiety, depression.
The trial is not about whether she did it.
Of course I can, they say. And then when push comes to shove and you're seeing it live and you're looking at baby clothes and you're looking at the instruments that were used to end their lives, it's a whole different story.
Yeah, and they actually showed some of the autopsy photos, which anytime that's involving children, I'm sure for the jurors, that stays with you.
Yes, and when you have the witnesses that are, big burly men that are in law enforcement and they're shaken up and their voices are cracking and they feel like to cry. And even though they know the breathing technique where you take that breath in and you hold it and you let it out gently so that you can control your emotions, it's not working because they're fathers too. And they are family men and they see this. So it's going to have so many repercussions when you see what's going on in the courtroom. Also, it's important to say and important to add, being on so many cases where I've been in the courtroom with jury selection as well as consulting, it takes you a long time to get over serious cases that are very visual. And
it is about what the law says when a mother kills while drowning in a psychiatric emergency. That legal question has placed a Massachusetts psychiatrist named Dr. Jennifer Tufts at the center of the case. Dr. Tufts began treating Lindsay Clancy in September 2022.
She had an appointment with Lindsay just one day before the murders, and listen to what she said in court.
At any point in time on the 23rd, did she say she was planning to kill her children?
No, absolutely not.
At any point in time during your interaction with her in that session, was there anything about her affect or demeanor, her behavior, that indicated to you that she was a danger to herself or others?
No.
Over roughly 4 months, she conducted 14 sessions. Every single one was by telemedicine. Defense attorney Kevin Reddington used cross-examination to walk the jury through what that distance meant. He asked whether she knew basic facts about her patient, whether she knew when Lindsay got married, whether she knew if she was a good student. The answer, repeatedly, was no. Then the questions turned harder. Did she ever meet Lindsay Clancy in person? Correct, She did not. Could she see her patient's body tremble? Could she place a hand on her shoulder? Could she look past the camera? No. She could look at a screen. She could not give a hug.
Friends say that Lindsay said she told them that she was having dark thoughts because of a medication she was taking, but that she was trying to change that medication and that she was hopeful. And eventually, weeks before the murders, Lindsay went to an inpatient psychiatric facility.
The record is clear. The doctor's primary diagnostic tool was a video call.
Were you ever concerned about her mental health as a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time she said it was difficult to get out of bed.
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
Because she was very depressed.
And did you give her a hug? Oh no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually.
This is where the first contradiction appears. Dr. Tuss testified that on January 23rd, one day before the killings.
So during cross-examination, Dr. Tufts admitted to Clancy's defense attorney that she had never actually met Clancy in person. And this part shocked me, that all of her appointments were done via telehealth.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they are?
Yes.
And you know that Lindsay was a nurse, correct?
Yes.
You know that she graduated, obviously, from college, right?
Yes.
Is she a good student?
I don't recall.
Do you know when she got married?
I don't recall
Did you
that
ask her?
specific detail. I don't know. I knew she was married.
She had 3 kids, right?
Yes.
And the reason that you know that she was married is because you spoke to her husband, Patrick, correct? Or did you?
Sorry?
Or did you?
He attended one of the appointments, and I spoke with him on that date.
And did you say, hi, how are you, and give him a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say that after, 14, you said to the jury, 14 appointments that you had with Lindsay during that period from September till January? 14 appointments?
Yes.
Every single one of them were by telemedicine, weren't they?
Yes.
Until you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
She saw no indication that Lindsay Clancy was a danger to herself or others. But by that point, the medical record already showed something else. 13 different psychiatric medications in 4 months.
Oh, this is going to be one of the hardest for juries. There's no question about it, because there's so much emotion involved. And when you do jury selection, yes, there are questions that are asked. And, they ask if you've had any psychiatric or psychological problems yourself, or a family member that has, or how you feel about people in the psychology field, psychiatry field. And you ask, what about children? Can you take seeing bad things happen to children? And people will say, sure, no problem. Can you separate your emotion from fact? Of course I can, they say. And then when push comes to shove and you're seeing it live and you're looking at baby clothes and you're looking at the instruments that were used to end their lives, it's a whole different story.
A hospitalization at an inpatient facility. A woman writing that she could not get out of bed. A woman saying, I want help. I want to be well.
And there was another psychiatrist. This one was named Dr. Aaliyah Goodhart. And that was her doctor at the psychiatric facility. And Dr. Goodhart diagnosed her with insomnia and said that she was working to get her on the right medication. Dr. Goodhart said that Lindsay asked to leave a day early from a psychiatric hospital because she wanted to attend her child's birthday party.
What were identified as maybe protective factors that made you feel comfortable that she was safe?
She was future oriented. She was clearly invested in her children. She was a caring mother.
She begged for help. That is not a closing argument. That is the shape of the paper trail. The court also heard from a second psychiatrist, Dr. Aaliyah Goodhart.
And they say days after the murder, she could not speak because she was on a ventilator, but asked for a pen and paper to write responses to questions. And she wrote that she was horrified and she asked for a lawyer. She also asked, "Is my body broken?" Defense attorney
Who treated Lindsay at the inpatient facility. Dr. Goodhart noted that Lindsay asked to leave one day early to attend her child's birthday party. She described her as future-oriented, invested in her children, a caring mother. Those notes are now being read in the same courtroom where autopsy photographs of those same children have been shown to the jury.
Well, you have to also look at the expert witnesses, the experts, her body language. One thing about her body language, it's very genuine. She is really devastated by what happened. And you see her shoulders shaking, she's crying, even though her hair covers her face. She's just devastated. There's one situation where she actually has her hand digging into her lawyer's hand when things have come up. So she is very upset. And people in the jury take note of that. They look at everything. They're looking at her, they're looking at the evidence, and they're looking at the whole picture. Also, you have to look at the psychologists. How did they come across? Some of them didn't come across that well. So you kind of wonder, is this a case where she had a mental issue? Is this a case where there was medication involved? So, you really have to look at everything, but it's a human reaction at this point. And when you look at the whole picture and you see this woman who, yes, her children are gone, but yet she's not like some people you see in the courtroom who just sit there like this, or they, bored or whatever. She's really reacting, and that means a lot.
How can you tell? It sounds like you think she's genuine in her emotion. Because I've been in courtrooms where it doesn't feel genuine with some other people. You know what I mean? Where it's like, you're like, I'm always looking like there's no tears there, but why do you think this is all real?
Because it's being brought to her right in her face, with the clothing, with the pajamas, with the, everything that's so real. And again, she's reliving it. And so it's real in the sense that you see what the emotion is. She's not faking it. And looking at body language, as I've done for decades, I can tell you when someone is being genuine and not. And she really is. And the genuine is the emotion that she is broken up by this. And when she takes her hand, this is very telling. When she takes her hand, you can't even see that in the courtroom. I mean, I don't even know if the jurors could see that, but you could see it through the cameras, and you saw her hand over her attorney's hand, and she was squeezing it and, like white knuckling it. And that tells you a lot. And she's just...
The prosecution says the evidence proves planning. Lindsay sent her husband out to run errands. She knew what she was doing. The defense says the evidence proves a cascading medication failure. The same records support both readings. That is why the medical testimony matters so much.
What about her being in the wheelchair and, allegedly trying to take her own life, and she didn't die, but she ended up paralyzed? To me, that's a really important element. Like, if she had just killed her kids but didn't do that to herself, I think a lot of people would be thinking differently about this whole thing. Exactly.
It's not like she just killed them and, there it is. But she did try to kill herself. She couldn't live with it. She didn't want to live with it. And that tells you something.
Here is the question the trial forces. When does a medical system's failure to see a patient in person become an institutional blind spot that ends in homicide. Not a rhetorical question, a legal one.
She's not saying, well, wait a minute, let's look at this, let's look at that. She's not aggressive about things, and I think it kind of puts another spin on it, a little sympathy. Yes, the children are dead. Yes, she killed them. It's horrible, and there's no coming back from that. And you're right. Some people are black and white. No, she killed the kids. That's it. Goodbye. Whatever happens to you, we don't care. And then there are other people that have another take on it and feel, if it wasn't for the medical facilities, something would have happened. And she did know she had a problem. This is what will work in her favor. Apparently, she went several times to get help. It wasn't just a one-time thing. That tells you a lot. It's not like somebody ignored it, put it under the carpet. She begged for help. So you wonder who is accountable. There is anger here, but who are you going to be really angry at that caused this? Is it her? Is it the medical establishment? We do know she did try.
Because if the doctors who prescribed 13 medications never once looked into her eyes in a room, then what exactly were they treating? She begged for help.
What about the husband or the ex-husband who is also sort of taking her side in terms of blaming the doctors and saying that this was postpartum? Does that impact the jurors? I mean, will they take his feelings into account?
Oh, sure. Unlike other cases where you've had the husband say, this is horrible. She deserves the worst. I, never, give her the death sentence. We don't care. And you don't see that here because he lived with her. He saw the depression. He saw the postpartum depression. He probably saw her try to get help and help was not there for her. So he's been there, and his whole demeanor of being supportive of her is kind of a humane act, if you really look at it.
After the killings, Lindsay Clancy could not speak. She was on a ventilator. She asked for a pen and paper.
Attorney Kevin Reddington has spent a lot of time also going through the medications that Lindsay was prescribed. And there are court records that show that Lindsay was prescribed 13 different psychiatric medications by multiple providers in the 4 months leading up to the murders. Things like Zoloft, there was Seroquel, basically sedatives and mood stabilizers. And he argues that this was a big contributor to...
She wrote that she was horrified. She wrote, "Is my body broken?" That sentence, like the first one, is now part of the record. 2 notes. One written before. One written after. Same voice, same exhaustion.
Again, I don't know. And that's because I'm professional. I have to say that.
Yeah.
If it was me personally, and I hate that the children are deceased. I despise that because they lost a chance at life. However, if I have to point my finger at somebody, I'm going to look at the medical community very strongly, especially the therapists. I did not like them on the stand. I did not like how they delivered themselves. I did notice that she did go to other facilities and try to get help. So, and I did, in watching her in the courtroom, I didn't hate her. So that tells you a lot.
The trial will continue for weeks.
It's horrible. And, people are comparing this to the Susan Smith case,
Yeah.
which I analyzed back in the day. And I told people from day one on camera, there's something wrong here. She's not telling the truth.
Yeah.
Because you could tell, there are so many signals of deception. In fact, when I give lectures to law enforcement, I use that video to show exactly where the breakdown is. You didn't see that here. And you certainly don't see this with her. But one of the most heartbreaking things is the husband. And you see his reaction, and that's going to go into people's minds too. So there's so much emotion here. And this is one of the most emotional cases. That's why people are riveted to it, because they want to see what's going on.
Yeah, you bring up the Susan Smith case. I actually covered, I think it might have been like a year ago. She was up for parole. So I went to the hearing, and it was so sad because the kid's father was there, and he's since moved on and remarried. But that is a very different case. I mean, she lied and she tried to blame the black man and made up this whole story. I mean, it's hard to compare those two.
She was really so deceptive. And when
Yeah.
she did the press conference, you see everything, the blinking, the fake tears. This isn't the case here. This is a woman who she really doesn't care. I was trying to think what is in her mind, what's going on with her. And at this point, she's pretty calm. She doesn't care really one way or the other. She's lost out on life. She lost out on the kid. She lost out on her physical being. And so, she's prepared to take whatever it is. People think she should be the rest of her life in a mental institution. Maybe that's the worst punishment for her, because or maybe jail or whatever it is. But she's pretty much resolved. I mean, she is going to accept her fate, I think, either way.
Does that have an impact on jurors, like them knowing that about her?
Absolutely, because she's not arrogant.
But the documentary evidence is already available. The cross-examination of Dr. Tuss is public. The medical records are public. The timeline is public. And in that timeline, there is a recurring phrase that should be repeated until it loses its comfort. She begged for help.
So, what do you suspect it's going to be like in that jury room? Like, kind of take me in, because I'm always fascinated by, and I know you've probably like interviewed jurors when they come out, like, when things are over. You have a good idea of what it's like in those rooms. I'm
Oh,
always kind of fascinated by that. Like, what do you think this is going to be like?
Well, sometimes they can go fisticuffs, they can punch each other, or
Can they
want to punch
really?
each other up. Oh, sometimes it gets volatile.
Does it
And
really?
sometimes it gets just horrible. They don't just sit there, well, let's take a vote. I mean, somebody's so passionate, and they're yelling at the other person, telling them how stupid they are. So, I mean, these are lay people. These aren't like professionals that are going to, oftentimes, they're going to, they're going to say what's on their mind. And the strong ones are, a lot of times, are going to be convincing the weaker ones, or the people that don't want to budge, and then they'll go after them. So it's not going to be pretty. On the other hand, it may be, yeah, we all believe the same way, and maybe somebody needs to be convinced. So you put it out there, well, this is why I believe that. And maybe they say, yeah, that's a good point. Or maybe they say, no, I'm not budging. So again, you never know. A lot of times after the jury comes out, they don't want to talk to you. They hate you too. They don't want to have anything to do with anybody.
You mean like when you've tried to interview them afterwards?
Yeah.
Yeah.
Oh, yeah. They don't want to know you. They don't want to talk to you. They'll look down. They don't want to, no, it's over. They don't want to tell you why or why they believe it. You see all these shows on TV where all the jurors get together in this row, a front row and a top row and a bottom row, and they're talking about a case. That's usually not the case. They don't want to get involved. They don't want to be seen. They don't want their identities known. So it's a very emotional thing for them too. Also, they have so much emotional baggage now. Where do they put it? What do they do? Do they go to a therapist to handle all this? How do they cope with seeing this? They can't unsee what they saw, and it's going to be stuck in their psyches forever.
Do you think there could be a hung jury? Because I'm just thinking, could there be a holdout of she killed her kids, I'm not budging?
Yeah, because some people are so, they're saying, no, I hate doctors. I hate psychologists. I hated those two, or the women on the stand. She did try to get help. They can say, yeah, I can't stand, I'm not budging. Other people say, but look, the kids are dead. They're dead. What are you going to do? Justice needs to be served for those poor babies. So, you're going to have that type of argument, and it may be hung.
Now, if you want to see the evidence for yourself, pull the Massachusetts court docket and read the cross-examination of Dr. Jennifer Tuss. The question I want you to answer in the comments is not whether Lindsay Clancy killed her children. That is established. The question is whether the medical record shows a system that heard a cry for help and still chose to look away. If you found this breakdown useful,